This is Health Matters, a podcast from Mayo Clinic where we discuss the latest medical advice, news, and research to help you live a happier and healthier life. My name is Kristen Meinzer. I'm a writer and journalist, and this episode, we're talking about outdoor first aid. Our guest is Dr. Neha Raukar, who works in the Department of Emergency Medicine at Mayo Clinic in Rochester, Minnesota. She also works in sports medicine to help athletes return to play after injury. Dr. Neha Raukar, welcome to the show.
Thanks for having me.
We are so excited to have you here at this time of year when we're all enjoying the great outdoors, or I should say, at least on the Northern Hemisphere, a lot of us are doing it this time of year, hiking, camping, and whatnot. And I got to be honest with you, this conversation is probably very important to me because as much as I love hiking, I never think to bring first aid with me of any sort. So let's just start off by discussing what makes outdoor first aid or wilderness first aid different from regular first aid, and why is it important?
So I totally agree with you. Even my first time hiking, I did not bring anything but a fleece, and that was it. And I remember thinking I saw somebody who was injured, and I was like, oh my God, I have nothing with me. And it started making me think like, oh my goodness, even for little hikes, I should be bringing at least something. So I think the difference between the wilderness and wilderness first aid and like first aid in the city is exactly that. It's the environment and how far you are from civilization or from medical help. And also the unpredictability of communication, right? Like a lot of these places don't have good cell phone service. You can't just call 911 or poison control. And so that makes you in your own little bubble. And we want that when we want to go on a hike. We want to escape and unplug. But that also comes with its own list of risks.
Yes. It's very different when literally there's a hospital 2 blocks away when I'm just tramping around the city. And it's quite a different thing if I'm, in the mountains in New Zealand.
Right, right.
So let's talk about the different kinds of injuries. You said you, on one of your very first hikes, came across somebody who was injured. And I'm curious, when is an injury a big deal? And when is it just like, this is just part of life, this is part of hiking?
It depends on so many things, right? It depends on how comfortable the person is managing their own injury. So what I came across was somebody who had stumbled the wrong way, twisted their ankle the wrong way over some uneven rocks, right? And so his ankle looked a little deformed. And the question was, do you need to go to the hospital right away? Do we need to call somebody to come and get you? Can we manage this here? And so the things I think about are, how serious is this? Is it potentially life-threatening? Could it lead to long-term complications of the limb, like his foot or ankle? Are you able to treat it, and do you feel comfortable treating it? This was just a day hike, but if you're out for days and days and someone twists their ankle, how is this going to affect the rest of the trip? And what kind of environment are you in? You're expecting that it's going to get so much colder as you ascend a mountain. Whatever injury you have, what's going to happen? What are the consequences of it? And so I think some of it's just your own risk management or risk tolerance.
Now, I am mostly comfortable, I think, assessing myself. I can say, you know what? These blisters suck, but I really want to finish this hike. I can go on a little bit further. Oh no, this is a bone sticking out of my body. This is a problem. But I guess I would have a harder time if I were you on that occasion when I came across that person with a twisted ankle. I wouldn't know what I should do. I wouldn't know how to help them assess that. Do you have any tips for somebody like me who's not a doctor, who's trying to just be a good fellow hiker on the trail?
Yeah, I think the things to look out for are, how mobile are they? Like, can they finish this hike with very little pain? Or if it's going to affect that. And then asking the person how they feel. Like, are you comfortable with this? These are the things that could maybe go wrong. And are you comfortable with managing that, or at least identifying it? And do you have a cell phone? So if you need help, can you get help?
Let's say I am the person who is on the trail laying down or limping or whatnot. What kinds of things should I be relaying to you, to my fellow hikers, or to a doctor? What kind of information is going to be most helpful for you to know?
Well, I think depending on the injury, but if we think about this broadly, we're sort of interested in what kinds of symptoms are you having and being pretty specific, like not just it hurts, but it hurts and it radiates and I'm having numbness or I'm having tingling or I feel dizzy, just giving some level of detail of what you're feeling. I think it's good to know what allergies the person has, especially if you're talking to 911, what medications you are taking on a regular basis, because that gives an idea to whoever you're talking to, what your medical background is, what kinds of problems that you have to begin with. And then, have you ever had this before? What led up to the injury or illness? And what have you done about it? Like, oh, I put ice on it and it felt a little bit better. Or I put ice on it and it did not feel better. Just knowing like what worked and what didn't work, I think is very helpful.
Mm. And what are the most common outdoor related injuries you see in your work?
So I work in the emergency department, but then I also work on sidelines as a sports medicine physician. And so in the emergency department, we see everything. We see temperature related things, so heat illness, but then on the other end, cold related illness.
Mm.
And these extremes of heat or temperature can cause their own problems like frostbite or heat stroke, but they can also exacerbate underlying issues. Like if you have respiratory conditions and it's super hot out, you're going to have a worsening of your respiratory condition. And then I see a lot of trauma where I work, and that's usually related to speed, like high speed car chases or high speed accidents. And on the coast or by the lakes, we'll see a lot of drownings and water related injuries. And of course, the sport related injuries.
Mm. So you were saying that temperature related issues are some of the biggest when it comes to outdoor safety. This is something that you see a lot in patients. What does temperature related exhaustion look like, or temperature related injury look like?
You know, especially in warm weather, people get really excited when it gets warm out and they go out and they do so much. And there's a whole spectrum of injury that can occur as a result of being outside and exerting yourself. And we've all seen some of this, right? There's a heat rash where you have all these bumps on your skin, but it can go as far as getting dizzy, feeling nauseous, and just feeling foggy. We see people all the time who come in with dehydration because they were just trying to do so much. They just want to get another mile in on their run, or they wanted to just finish raking one set of leaves or finish gardening or whatever they're doing. But that can continue to progress if you don't stop. And that can go right all the way to heat stroke, where patients or athletes or hikers are actually confused and don't know who they are, don't know what they're doing.
Mm.
And when you're confused, you make more mistakes, especially if you're outside in the outdoors. And so then you're more prone to injury. There's the chance to make things worse if you don't take a break and cool down a little bit.
And what is the best course of action in that case if I or somebody I'm with is getting overheated or dehydrated?
The first thing that would do would be to try to get out of the sun and get in the shade, get someplace cool if possible. And if the person's feeling dizzy or feeling foggy or just not feeling well, lying down and elevating your legs a little bit,
Mm.
encouraging fluids like drinking water, drinking cool fluids, and just sipping on them. And if you have electrolyte drinks, that helps as well. We always try to recommend drinks without alcohol or caffeine in these instances. Just water is great. And cooling the person down as well you can. Fanning them, or if there's like a little shallow body of water, cooling them down by just walking into the shallow body of water. Just doing things to cool them down a little bit.
And what is actually happening to your body when you're experiencing heat exhaustion?
With heat exhaustion, what happens is your whole body vasodilates. So a lot of the blood will pool down in your legs. So if you lie down and raise your legs a little bit, you'll give more blood back to the heart, and that will give more blood back to the brain. So you're not having those neurologic symptoms like feeling dizzy or confused.
Oh, fascinating.
So, like at the end of a marathon, you'll see a lot of people who had just run the marathon. They go into the medical tent because they're feeling dizzy or so hot, or sometimes people collapse, and it's because all the blood's pooling in their legs. And so we just want to lift those legs up a little bit.
I don't have to lay on my back with my feet straight in the air.
Right. Right. It's not an ab workout. It's just a couple of inches.
Got it. Got it. So, we've talked about what we might experience when overheated, but what about on the flip side of things? What if I'm getting cold or somebody I'm with is cold and I suspect hypothermia, maybe even frostbite? How do I even know what that looks like and what I should do in that situation?
So the cold injuries, often patients will tell you that they're feeling cold, but you'll see them shivering and you'll see that they are less engaging with you the colder they get. So if you suspect that somebody you know or you yourself are feeling hypothermic or maybe even some frostbite, frostbite's a little bit tougher because the skin turns colors. I would seek immediate shelter, look for a place where there's very little wind. If you encounter a person, try not to jostle them so much because their heart becomes more sensitive to movement. Remove any clothing that is wet because that's keeping them cold. And if you have the ability to warm them up with warm blankets or even just dry blankets, that would be very helpful. And we want to try to give them some warm beverages.
Got it. Does hypothermia, does it feel like I'm just getting really cold? Does it feel like something else? Does it feel like something's tingling?
Hypothermic people, so most people who are cold, your body is able to generate some heat through shivering, but after a while, the shivering may stop. So what you end up seeing is somebody who's like mumbling or breathing shallowly, or they're clumsy, or they don't seem as coordinated as they typically are. And like I said, they can be confused as well.
One of the best parts about being in the great outdoors, getting away from it all, can also be part of its danger. Because being far from civilization also means being far from medical assistance and even possibly cell service to call for help if you need it. That's where outdoor first aid comes into play. In case of injury or illness when you're out on a hike or climb, how do you step up to offer care? And how do you make informed decisions in the moment? Well, if you encounter someone who's sick or hurt, here are some questions to help you assess what to do. Does this person need to get to the hospital right away? Is this illness or injury potentially life-threatening? Or can it be treated and managed where you are? Also, how mobile is this person? How much pain are they in? If it's not a life or death issue, some of this is also up to the affected person's personal judgment, risk management, and tolerance. One of the biggest issues when it comes to outdoor safety can be illness due to extreme temperatures. Overheated or hyperthermic people may develop a heat rash or get dehydrated. They may feel dizzy or nauseous, foggy, and confused. In that situation, first, get that person out of the sun and into the shade if possible. To help, you can cool them down, elevate their legs, and have them drink cool liquids and electrolytes. On the flip side, in cold weather, people can get hypothermic. They might be shivering, less engaged, breathing shallowly, acting confused and less coordinated. If they're experiencing frostbite, their skin can even change colors. If this is happening to you or someone you meet, immediately look for shelter. Remove any wet clothing and warm them up with beverages and blankets. And of course, in either case, get medical attention as soon as possible. Next, let's talk about animal encounters out in the wild and other health risks. Let's get to some scarier stuff. Snakes, scorpions, insects, animal bites. How do I know if this is a real issue or a danger?
I would say part of it is knowing the region that you're in, what kinds of things are indigenous to that region. Like, are there venomous snakes? Are there venomous spiders in that area? And then typically by looking at the wound, you can't tell is this venomous or not. But by thinking about the symptoms or seeing how the symptoms progress, most bites are actually not venomous, but if the symptoms continue to persist after a day or seem to be getting worse, like the numbness, the tingling, the bruising, if that seems to be getting worse, or if you have other symptoms like you're getting dizzy or you're having stomach aches or nausea or vomiting, if the symptoms don't seem to make sense, then it's time to get checked out just to make sure that this was not a venomous bite. And if it was, to get treated appropriately.
And what is that treatment?
Well, for some things, there's anti-venom available. And for some things, it's just supportive treatment, like getting the right amount of fluids in you and sometimes making sure your electrolytes are okay. And if they're not, correcting them. It involves blood work and it involves a visit to the emergency department.
One thing I've seen on TV shows and in the movies a lot is people will be out hiking. One of them will be bit by a snake, and the other will immediately drop to their knees and start sucking the venom out of that bite. Is that something that we should all be prepared to do?
Definitely not. Definitely do not be sucking the venom out of a wound. It's not useful. It doesn't do anything.
Oh.
Removing the venom in that way doesn't actually help. The other urban myth, I'll tell you, is we were at the beach last summer and there were a lot of jellyfish washed up on the shore.
Mhm.
And my daughter said to me, "Oh, don't worry, Mom. If you get stung, I'm happy to pee on you." No, that's also an urban myth.
Got it. And what about animals that are not insects? For example, when I was hiking in New Zealand a couple of years ago with my husband, we accidentally came across about 100 baby seals.
Oh.
And some of them were barking. And then we saw, oh no, there are some adult seals nearby and they're really angry. And we got away from there as quickly as we could. But let's say we hadn't, and let's say one of the seals bit us. These are things to think about on hikes. Sometimes there are animal encounters. What should we do in those situations?
Like humans, animals have bacteria in their mouths. And when they bite you, they will puncture your skin and transmit that bacteria from their mouth into your skin. And so now you're at risk for infection. So animal bites typically get infected. And so, like I said before, washing it out with clean water as soon after the event as you can would be very, very recommended. But the other thing is also when you get back to civilization, following up with the physician or the emergency department or an urgent care. And if you notice that the area of the bite is getting red and the redness is spreading, those are signs that perhaps this is infected and you should get antibiotics.
So regardless of what animal it is, it's going to have bacteria in that bite.
Yeah, no one's mouth is sterile. Everybody's got bugs, even the cute seal. And I would also say that many mammals pose a risk for rabies. That's a deadly virus that's transmitted through bites of infected animals. And so if you're bitten by a mammal along your trail, including bats or coyotes or a fox, I suspect that you would follow up with somebody when you got back to civilization, but that would need a conversation about rabies treatment.
How fast can that bacteria or the rabies cause me to get really sick or to die?
It's very quick acting. So once this happens, you have to go down to civilization or the nearest urgent care and get treated for it.
So no delay. Don't finish the hike. Immediately stop things there and get help.
Turn around. Yeah.
Let's talk about some more commonplace injuries. We already alluded to things like blisters and wounds and scrapes can happen. How do we assess whether or not this is serious? Is there a certain point where you as a doctor would say, you know what, you now have this number of blisters, it's time to stop? Or the blisters are now this large, it's time to stop. Is there a general assessment that we should keep in mind?
I would say if the wound or blister or scrape is not healing like you've seen other ones heal, if it's getting worse, especially if you're seeing redness around it, or if you see redness spreading or pus coming out of it, that's more obvious. But that suggests that the area has gotten infected and should be maybe looked at by a healthcare provider, and maybe you need antibiotics.
Is there a way while I'm on the trail that I can treat those blisters? I mean, I will confess last year I did a 35-mile hike in a day, and my feet were pretty blistered, but I just didn't want to give up. And some of my fellow hikers gave up partway through, and they're like, I can't do this anymore. The blisters are too much. And I kept going. Was that dangerous? Should I have left with my friends?
I think that was very brave of you to keep going and risk getting more blisters. So first, we would think about preventing the blister in the first place, right? Like wearing well-fitting shoes, which I'm sure you were, but taping or putting some gauze on the spots where you know that you're going to get blisters. So next time, you'll maybe reduce the rate of blisters. And then if your socks get wet, changing into dry socks as quickly as you can. And when you see a blister occurring, I always recommend putting some tape or some padded gauze on the area or some moleskin on the area, just so it doesn't get worse. Once you have a blister, the blister gets so tight and it's filled with fluid, and that becomes more irritating, especially depending on where it is. So one thing you can do is drain that blister a little bit, or pop it, as people say, and let some of that fluid out and release some of that tension. You kind of want to do that as cleanly or as sterilely as you could, washing your hands first and washing the area, and try to be as clean as you can with your needle or whatever you're using to try to scrape it off a little bit and make a little hole so you can release some of that fluid.
Oh,
And then afterwards, putting some Neosporin or bacitracin or something on there just to try to keep it from getting infected. Because at the end of the day, you are outside.
that's good to know. So if it's done in a sterile, safe way, puncturing a blister is okay.
Yeah, you're allowed to do it.
Let's talk about accidents, sprains, fractures, falls. A lot of us, even if we're pretty adept at hiking, can trip over a branch, or maybe the rock will be loose as we're descending a hill and we'll take a spill. What should I do in that case?
There's a couple of things to think about if you take a spill. The first is all the abrasions that you're going to have all over your body or whatever's exposed, making sure that you wash them out as quickly as you can in something that resembles clean water, not dumping your hands in some mud, but maybe like a little water ball and washing off some of that dirt and just not exposing the open skin to dirt. And then when you think about the sprains and stuff, after you fall, I had a really, really big tumble skiing one time. It was like a yard sale. I had stuff for miles, I would say. There was just a pole here and a ski there. And when I finally made it to the bottom of the mountain with some help, I took a little while to like head, shoulders, knees, and toes. I sort of took a little assessment of every part of me, like what hurts now? Does this hurt? Does this hurt? Because I was so cold and I was so embarrassed and I was just hurt all over. And it takes a little bit of time just to figure out what actually is the body part that hurts. And then after you identify it, take a look, like roll up your sleeves or roll up your pant legs and just see, is it cut? Is there bleeding? Is it swollen? And not only looking at it at that time, but then looking at it a few hours later, because sometimes swelling takes some time to appear. And then just keeping a little mental log of, oh, my ankle is still kind of hurting, but it's not getting worse. Or, you know what, my ankle is hurting and it's totally getting worse. And now it's more swollen and now it's more bruised. And these are little clues like, this might continue to get worse. Maybe I should get this checked out.
I really like what you said there about admitting that you were embarrassed when it happened, because I think that factors in a lot of the times when we hurt ourselves when we're doing outdoor activities, that maybe sometimes we feel like, oh, well, this is mortifying. I need to keep going.
It's so true.
It's okay. The embarrassment happens, but you still have to be honest with yourself about what your body's going through in that moment.
Right. You can tell the neighboring person, I'm totally fine. But at least to yourself, be honest. And then if you need help, reach out. I took a spill yesterday. I'm needing some help today. My ankle seems to be worse than it should be. Because somebody else may be able to help you.
Now, what about things that happen when we're outdoors that maybe aren't as obvious? Looking at me, you might not be able to see it, but maybe I'm feeling a shortness of breath. Maybe I feel some chest pain or something doesn't feel right in that way. What should I do at that moment?
So whether it be you or one of the people you're going with, sometimes people, they get embarrassed or they don't want to bother you and they're feeling some chest pain. They don't want to ruin the trip for everybody. But this is really something where you have to have some level of trust with the people you're traveling with. And before you go, there has to be some level of preparation where you tell each other, I have a history of a heart attack. And so I know that if you come to me later and you seem short of breath or you're complaining of chest pain, I know how to take care of you as well as I can. We have to share at least the things that can get worse. And so if you're feeling chest pain or if you notice somebody is gasping or taking more breaks than usual, or just doesn't seem quite themselves, I think it's good just to say, you know what, we should just take a break right now. Let's just sit down and let some time pass, see if the symptoms go away, and take the time to reach out and ask your friend, hey, how you feeling? You look like you were having some trouble back there. Because not all things are obvious. Not everything is bleeding and you can just tell. Sometimes you just can't.
Let's say I don't have any hiking buddies with me, and let's say I'm feeling those things. What should I do then?
That's a more dangerous situation, right? Not to have a buddy with you. And so, knowing your own medical history, you should call for help because chest pain, shortness of breath, these things, especially if you're alone, if they progress and turn into something worse, then you're going to be alone and no one's going to be there to help you.
On the flip side, can I leave somebody alone who's going through something like this? Is it okay for me to say, I'm going to double back on the trail and try to find other people? Or is that the worst thing to do?
I think as long as you're safe about it, as long as you put them with some shelter, some water, some food, and you leave a trail so you know how to double back and not get lost, it's okay to leave them alone. But you have to try to stabilize the person as best you can first. Like if they're bleeding, at least control the bleeding before you run off. And if their ankle or whatever is hurt, at least put them in a comfortable position before you run off to get more help.
So we've talked a little bit about scrapes and blisters and minor cuts, but let's say it's something more severe. For example, my husband was mountain biking a couple of summers ago, and he took a bad spill. And he wasn't alone, he was with somebody, and there was a lot of blood. What in the moment is the best thing to do when there's a lot of blood gushing out of a leg?
I'm sorry that happened to your husband. So when you say somebody had blood spurting out of them or gushing out of them, that definitely makes it sound like it's pulsatile and that is arterial. That is definitely an emergency. In general, when people are bleeding, the best way to treat it is just to hold firm pressure for about 20 minutes and don't let go. Don't peek underneath, just hold pressure and let the bleeding stop. In cases where people have arterial bleeds where it's spurting out, you may need a tourniquet because you can hold better pressure with a tourniquet because it can be tighter. But unless you're going to go to the emergency department, tourniquets in general are not necessary. In general, good pressure is the way to go.
Got it. But doctor, sometimes when we are injured, when we're, having that ski accident you had or a mountain biking accident like my husband, sometimes we might actually get an adrenaline rush. And that might make it hard for us to self-assess how well we're doing, right?
Yes, for sure. So after I took my tumble down the mountain, there was definitely a lot of adrenaline flowing. That's why, I waited till I got to the bottom of the mountain. I did a little self-assessment, and then I did it again a little while later, once the adrenaline comes down, once my heart stops racing, just to make sure that I was not injured in other places. And you'll find that often you'll identify areas that are hurt or bruised that you didn't identify the first time around when your adrenaline was racing through you.
If you're bitten by an insect while in the great outdoors, first remember that most bites are not actually venomous. If you notice symptoms that persist after a day, like numbness, tingling, bruising, or if you feel dizzy, nauseous, or have a stomach ache, get checked out by a doctor. When it comes to bites from animals, the bite will puncture your skin and transmit the bacteria from the animal's mouth, which typically leads to infection. So if you get a bite, wash it out with clean water as soon as possible. And follow up with a physician in case you need antibiotics. Many mammals also pose a risk of rabies, which also needs immediate attention. For more commonplace injuries like scrapes or abrasions, see if your wound has redness around it. If you notice that redness is spreading, if it's not healing normally, or pus is oozing out, these are signs of infection. For sprains, fractures, and falls, make sure to wash any abrasions. Check your body right after you fall, and even a few hours later, once the adrenaline has worn off, to see if you have any swelling, pain, or other injuries. And in general, don't be afraid to ask for help. After a fall, but also before anything happens. If you're going outdoors with a bunch of friends, tell them of any relevant medical history so they know what to look out for if something happens. Next, let's look at how to prepare yourself when heading into the great outdoors. Doctor, we started this conversation with me admitting I never bring a first aid kit with me when I go hiking, when I'm doing outdoor activities. But it sounds like maybe I should. And if that's the case, how many items should I be bringing with me? And where should I bring this first aid kit to? Do I bring it to the beach? Do I bring it when I'm hiking city parks? Or do I only do it when I'm on a mountain or in the middle of nowhere?
Yeah, so these are good questions. So, like we started this segment saying, what is the wilderness? What makes the wilderness so different? And I think that if you're walking down Fifth Avenue, that's different kind of wilderness, for example, than Glacier National Park.
Yes.
And so I think it's a little bit about what your environment is, how long you're going to be away from civilization. What's the environment where you're going to be? Like, is it going to be hot or cold and what you'll be doing? So if you're just sitting on a beach, that's different than I'm going to be hiking 32 miles. And so I think it's dependent on all these different scenarios. In general, I think that if you're going for a day hike, I don't think it's a bad idea to have a small little first aid kit for cuts and scrapes and blisters and things like that.
So what types of things then would be in there? Band-Aids or some gauze?
When you're going away for day trips, first making sure that you have access to communication. So bringing your cell phone, making sure it's charged up. If you need to have a backup battery or a solar backup battery, having one of those. Of course, Band-Aids and gauze and splint material is really great. I think even having material for bleeding, so a tourniquet or gauze and tape for bleeding, because that can happen anywhere. Having a little thing of saline to help wash out wounds if you get scrapes or cuts is very helpful. Or you can use water for that as well. And then also carrying a pair of gloves may be helpful just in case you encounter somebody else, so that way you can help them as well.
And I love what you're saying. The most important thing is just making sure you have your communication device, because that can be the number one helper in an emergency is your phone.
That's for sure. And if you have friends who have allergies, having an EpiPen is also a good idea.
Nice, nice. So aside from the first aid kit, though, and we already mentioned clothing earlier, protective clothing, is there anything else that I should be thinking about bringing with me before I leave home for a hike or mountain biking or any other outdoor activities?
I think consider the same things you would consider for any other outdoor activity. So maybe having an emergency blanket, making sure that you and everybody on your trip has their daily medications that they would be taking, making sure that you have the phone numbers for emergency contacts and for poison control, and making sure that you have backup batteries. And I always also have a little packet of everyday medications like ibuprofen and aspirin and cough medication, just in case I need them.
And making sure you have enough snacks and beverages, because you've mentioned water many times in this conversation, or a beverage with electrolytes.
Right. That's going to help us go farther.
Yes. And also, just one last bit of preparation may be worth considering. Outdoor wilderness classes, first aid classes. Do you think there's a benefit to us taking those kinds of classes, or is that only necessary for people who are doing things like climbing Everest?
There's all different kinds of classes. There's kinds that are only a couple of hours to those that last a whole month. And so I think, especially if you're one that does venture outside, like it sounds like you do, I think knowing some wilderness first aid and having some tricks up your sleeve is totally invaluable. Oftentimes, when people come across somebody who's injured or when you're injured yourself, sometimes people freeze up. And these sorts of classes give you some muscle memory. So when you come across these situations, you don't freeze up and you just sprint right into action and you know what to do. And I think there's a lot of value in these classes. And if you don't have the time for a class or to supplement what you learn in class and have more information, consider the Mayo Clinic First Aid Guide for Outdoor Adventures. It's a very small book that you can just throw in your bag. It's waterproof. It's got important phone numbers and tips of the trade. And if you come across somebody, it's pretty well organized. So you can find what you need quite quickly and help them out in a situation.
Oh, excellent. Well, I know I'm going to get my hands on a copy. I think that's going to come in handy for me too. Well, Doctor, thank you so much for all of your expertise today. And I think you've given us all a lot to think about and a lot of ideas of how we can all be safer and take care of our fellow outdoors people in a more proactive way if we have to.
Yes. And don't forget, though, the most important thing is just to have fun, like to relax and take the opportunity to unplug and just make sure you do it safely.
It's best to be prepared in case of injury when outdoors, which of course means bringing along a first aid kit. Make sure yours is equipped with Band-Aids, gauze, splint material, and other materials to stop bleeding, like a tourniquet and tape. Saline is good to wash out wounds. Keep a packet of everyday medications like ibuprofen and an EpiPen if you or someone you're with has any allergies. And don't forget the importance of a phone and a backup battery in case you need to call for help. It's also good practice to have any relevant phone numbers and emergency contacts on hand. If you want to go the extra mile and are heading out for a more extended or remote trip, pack an emergency blanket. You can also check out outdoor wilderness classes if you want to feel more confident and informed, and of course, the Mayo Clinic First Aid Guide for Outdoor Adventures. Have fun and stay safe on your next trip to the great outdoors. Okay, that's all for this episode. But if you've got a question or topic suggestion, you can leave us a voicemail at 507-538-6272. We might even feature your voice on the show. On the next episode of Health Matters, foodborne illness, aka food poisoning. Are you saying that all foods already have pre-existing bacteria in them, but they just grow amok if they're too old or they're left out too long?
So there is bacteria on everything. There's bacteria on our skin. There's bacteria on every surface. And usually it has to be in a certain environment for it to produce toxins. And it's when they produce those toxins and then you ingest the food with those toxins, that's when you become sick.
For more Health Matters episodes and resources, head to mayoclinic.org/healthmatters. And if you found this show helpful, please subscribe and make sure to rate and review us in your podcast app. It really does help others find the show. Thanks for listening, and until next time, take care and stay healthy.
If you're a podcast host, listen up, this one's for you. My name is Allie Jackson. I'm the host of Finding Mr. Height, a dating and relationship podcast that I've been doing for 4 years now, sharing my positive and practical approach to dating that's built on my own life experience. And I wanted to share another experience that I've had, my secret behind monetizing my show. It's called Red Circle, and I was just telling my colleague about how much I love their platform. With Red Circle, not only am I getting a seamless hosting experience, but I also love the support I receive in ad sales. It's not just typical ad sales either. It's targeted opportunities based on my show and my life. And the platform is super simple. You just set your preferences and Red Circle matches you with sponsors that align with your show. You can vet every opportunity and their platform gives you great analytics. More recently too, my Red Circle team has brought me opportunities outside of my podcast on social media to really augment the podcast partnerships, bring them full circle. I just can't recommend them enough. If you want to give it a try, go to redcircle.com to get your free trial. That's redcircle.com for a free trial.